What we're actually seeing is the systematic implementation of the fall of the republic and the rise of the corporation of the United States. Every major event is a step in the ladder to achieve that end. COVID is just another rung in the ladder, which is why there's a deliberate mixing of all the wordplay, right? I mean, we should stop calling it, quarantine. That's a term designated for people that are verified sick. This is a house arrest mandated by the state. You should stop calling it, social distancing. There's nothing social about forced isolation. We should stop saying safer at home when millions of Americans don't have basic necessities adequate to fit their needs. It assumes that everybody's home is equally as safe as the people that are making the statements. We should stop saying, this is for the greater good, right? When you close the economy, killing millions of businesses that families have worked generations to establish, that's anything but good. We should stop saying this is the new normal. That's just blatant mind control drivel. There's nothing normal about forced isolation, treating your neighbor like they have the plague, breathing your own bodily waste, wearing masks, living in constant fear of contamination. That's normal. I mean, after all, if the virus is so deadly, why hasn't it wiped out the homeless who don't social distance, wash themselves regularly, let alone, live in or have access to a sterile environment? Last year, 1.5 million people died of tuberculosis. Why were you not wearing a mask during the tuberculosis pandemic? You were endangering, public health and safety along with billions of other people around the globe. So why didn't you wear a mask? I'll tell you why. Because the mainstream media didn't tell you to wear a mask. Right? And so because though 1.5 million people died from tuberculosis, there was no tuberculosis pandemic any more than there's a coronavirus pandemic. What you're really participating in is a beta test for AI systems and facial recognition. See, these cameras work best when people are, distance apart. Now they're actually testing through machine learning how to recognize, a face that's partially covered. It's also a way to easily determine who's compliant and who's not. Who does the propaganda work on and who it doesn't? Now get this, there's some ironies that are here, right? A society that kills millions of babies a year for convenience has shut itself down to prevent adults from dying. People that on the one hand slaughter babies in the womb by the millions are now preaching to the masses about the sanctity of human life. It's double speak, double talk. It's the two doctrine policy. One for the initiated, one for the uninitiated. One for the inner circle, another for the masses. It's like saying, if I violate the stay-at-home order, I can be arrested, but you're letting convicted criminals out of prison so they don't get coronavirus. Thesis, antithesis, synthesis. If there's a real pandemic, does it require, faulty virus models, rigged test results, 81% false positives, inaccurate news reporting, staged hospital overruns, manipulated death certificates? Nope. When the government shuts down, millions of small businesses, but doesn't lay off any government employees, it's not about the health. When the state bans dentists from practicing but deems it necessary for abortion clinics to stay open, it's not about your health. When the state prevents you from buying seeds for your garden but allows you to purchase lottery tickets, it's not about your health. An institution that has the ability to destroy all of Earth through alleged nuclear warfare should not regulate personal self-defense. An institution that's caught trafficking drugs shouldn't be able to regulate plants. An institution that's racked up $23 trillion prior to coronavirus in debt shouldn't be allowed to manage the retirement fund. An institution that was caught spreading STDs should not be allowed to run healthcare. If people are really concerned about public health and safety, in general, but they don't care if people eat garbage, drink poison, smoke cancer, and take prescription drugs, but think that toilet paper, hand sanitizer, and masks are going to protect them from the boogeyman coronavirus. This is a special kind of stupid that I can't address here. You should ask yourself a couple basic questions. When did you consent from, you creating a government to serve you, to you serving the government ruling over you? You should ask yourself a couple basic questions. When did you consent from, you creating a government to serve you, to you serving the government ruling over you? If you want to know, who's in charge, just think about who you can and can't criticize.
So this morning we got a text from a politician, and if you host a talk show, you get a lot of texts from politicians, all pushing their own perspective in their program and spinning you. But this one was very different. It was from the Lieutenant Governor of Texas, Dan Patrick, who's been on this show before. He sent something very long and thoughtful, and I just want to share part of it here because it's worth hearing. And he wrote this, quote, "I don't pretend to be speaking for everyone 70 plus. But I think there are lots of grandparents out there who would agree with me that I want my grandchildren to live in the America I did. I want them to have a shot at the American dream. But right now, this virus, which all the experts say that 98% of all people will survive, is killing our country in another way. It could bring about a total economic collapse and potentially a collapse of our society. So I say, let's give this a few more days or weeks, but after that, let's go back to work and go back to living. Those who want to shelter in place can still do so, but we can't live with this uncertainty." Lieutenant Governor Patrick agreed to join us tonight. We're happy that he did. Lieutenant Governor, thanks so much for coming on. So you made clear, and I wanted you to say this and not me, but you made clear in this letter that you sent that you're in the category of people who face real risk from this disease. And I thought that kind of put it into perspective a little. Would you explain that?
Yeah, I turned 70 next week, Tucker, and I sent you a note about a week ago that something has been really heavy on my heart since this started. And, so I'm automatically in the high-risk pool. And I'm, as Lieutenant Governor, I work 12 or 15 hours a day, mostly from home now, but I travel when I need to. I'm living smart, listening to the President, the CDC guidelines, like all people should, but I'm not living in fear of COVID-19. What I'm living in fear of is what's happening to this country. And, Tucker, no one reached out to me and said, as a senior citizen, are you willing to take a chance on your survival in exchange for keeping the America that all America loves for your children and grandchildren? And if that's the exchange, I'm all in. And that doesn't make me noble or brave or anything like that. I just think there are lots of grandparents out there in this country, like me, I have 6 grandchildren, that what we all care about and what we love more than anything are those children. And I want to, live smart and see through this, but I don't want the whole country to be sacrificed. And that's what I see. I've talked to hundreds of people, Tucker, and just in the last week, and making calls all the time. And everyone says pretty much the same thing, that we can't lose our whole country. We're having an economic collapse. I'm also a small businessman. I understand it. And I talk with business people all the time, Tucker. And my heart is lifted tonight by what I heard the President say, because we can do more than one thing at a time. We can do two things. So, my message is that let's get back to work. Let's get back to living. Let's be smart about it. And those of us who are 70 plus, we'll take care of ourselves, but don't sacrifice the country. Don't do that. Don't ruin this great American dream.
You're basically saying that this disease could take your life, but that's not the scariest thing to you. There's something that would be worse than dying.
Yeah. And look, I'm going to do everything I can to live. But, if you said, are you willing to take a chance? And if I get sick, I'll go and try to get better. But if I don't, I don't. And I'm not trying to think in any kind of morbid way, Tucker. But I'm just saying that we got a choice here. And we're going to be in a total collapse, recession, depression, collapse in our society. If this goes on another several months, there won't be any jobs to come back to for many people. So I'm going to be smart. I think all of my fellow grandparents out there are going to be smart. We all want to live. We want to live with our grandchildren as long as we can. But the point is, our biggest gift we give to our country and our children and our grandchildren is the legacy of our country. And right now that is at risk. And I feel like, as the president said, the mortality rate is so low. Do we have to shut down the whole country for this? I think we can get back to work. And I think we should wait out his time. And if he says we need another week, I trust his judgment. But we have to have a time certain. We can't say in 3 months or 6 months or 12 months. Right. These businesses can't wait that long.